Aloha, everybody. Aloha. My name is Keiko Shinha, and I'm very excited to announce our speaker for today, Dr. Donald Warne. Dr. Donald Warne is the co-director of the Johns Hopkins Center for Indigenous Health. He's an acclaimed physician, one of the world's preeminent scholars in Indigenous health, health education, policy, and equity, as well as the member of the Oglala Lakota tribe in Pine Ridge, South Dakota. Dr. Wayne also serves as Johns Hopkins University's new Provost Fellow for Indigenous health policy. Warne comes from a long line of traditional healers and medicine men, and is a celebrated researcher for chronic health inequities. He's also an educational leader who created the first Indigenous health-focused Master of Public Health and PhD programs in the US or Canada at the North Dakota State University and University of North Dakota, respectively. Warne previously served at the University of North Dakota as a professor of family and community medicine and associate dean of diversity, equity, inclusion, as well as director of Indians into Medicine and Public Health programs at the University of North Dakota School of Medicine and Health Sciences. Warne received a Bachelor of Science degrees from the Arizona State University, Doctor of Medicine degree from Stanford University School of Medicine, and a Master of Public Health degree from Harvard T.H. Chan Schools of Public Health. Welcome, Dr. Donald Warne again. Thank you.
Haumitakeapi, pilamiayalo. I'm so pleased and honored to be here. Again, my name is Dr. Donald Warne. My Lakota name is Prejuta Wichasha. I was named after my grandfather, and Prejuta Wichasha means medicine man, and my grandfather was a traditional healer. And I've shared a lot already if you were at the earlier session today, but a couple important things to add. I've had the really good fortune to work with a lot of international colleagues in Indigenous health. And what I'll just be describing today is some of the work with the United Nations Permanent Forum on Indigenous Issues. I also work with the World Health Organization. They have a work group on traditional Indigenous medicine. And one thing that's very exciting is that there seems to be really a movement, almost a renaissance of indigeneity and pride in who we are and our histories and our cultures and the value that that brings to our work. And historically, we focused on the social determinants of health, and we've looked at the things that drive health disparities. But I think what's even more important is to recognize that we have such strength within our cultural backgrounds. And we need to leverage the culture and the strength to improve health outcomes. So it's important to understand the root causes of disparities, but it's even more important to identify solutions that will be effective and culturally relevant. So we'll look at indigenous determinants of health and cultural approaches to well-being. So again, the social determinants of health typically focus on poor health conditions that result in disparities. So this is things like poverty, inadequate housing, low educational attainment. And where I'm from, in Pine Ridge, South Dakota, we do have significant rates of poverty, very high rates of unemployment, limited job opportunities, but people want to be in their homelands. And one of the things that we do have is the strength of cultural connectedness. We still have a lot of traditional language speakers, and we have a lot of traditional ceremonies that go on throughout the summer and other parts of the calendar year. So we've always acknowledged the summer and winter solstice with ceremony, and also the spring and autumn equinoxes. So we have an equinox coming up very soon, actually, for coming up here in September. So we recognize the change of seasons, and we recognize that there are ceremonies and practices associated with that. And what I observe is that the people who tend to be more culturally connected and speak language and participate in ceremony tend to have better outcomes than those who are more disconnected from traditional culture. So we have formed what's called the Indigenous Determinants of Health Working Group, and we do have a website if you're interested in looking at this, Indigenous Determinants of Health Working Group, and it's Indigenous peoples from Pacific Islands, from Turtle Island, from South America, as well as Australia and New Zealand. And this was formed in 2003 to increase visibility and awareness of the health and well-being of Indigenous peoples. And then also we'll talk about strategies to measure wellness and strengths. I think in many ways, the reason we measure the social determinants of health is that they're easier to measure. I mean, you can measure poverty just by looking at income, but how do you measure cultural connectedness? How do you measure language preservation? These are a little bit more challenging things to do, but that doesn't mean that we shouldn't do it, right? That we should be figuring out these ways. And there's some very good templates and very good examples of how this can be done effectively. And I'll show a few examples of studies that have been done that show even things like language preservation in a community correlates with better health in that community. So if we have connectedness to culture and language and who we are, there's a stronger self-esteem, stronger self-awareness, and better health outcomes as a result. So how do we define health? And this is from the World Health Organization in 1948. They said health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So when I think about my own medical training, we would always have a hard time with patients where they would have vague complaints, or they'd get lots of visits to the emergency room or admitted to the hospital or to the clinic. But we had a hard time defining what the problem was with data. We didn't have laboratory tests or x-rays or physical data to determine what the health challenges were. So quite often they were labeled as the difficult patients. We can't identify the numbers that are correlating to some sort of a disease outcome. But in truth, what I observe is that we have a lot of people who have spiritual and emotional trauma that's unresolved. And that doesn't always translate into a laboratory test. There's no blood test for trauma, right? We can look at other types of measures and other types of data, but they're not taken as seriously in the medical sector. So if we want to address these things, we have to look at it in a much more holistic way. And it's not outside the realm of what we do in modern medicine. Even the World Health Organization, now going back all the way to 1948, recognized that there needs to be balance that includes physical, mental, and social well-being. So health is an individual right and a social justice issue. It is also a public good. And I think one of the strategies that we need to further employ is recognizing that when a population is healthier, it's actually good for the economy, right? And I think one of our challenges, particularly in the US right now, is that if we can't translate things into financial benefit, it's hard to move policy issues forward. So investing in things like public health, we obviously have the altruistic things like wanting people to live in a more healthy and balanced way, but in truth, it's good for the economy, right? Maybe that's part of our strategy, is to recognize that the healthier a population is, the more productive that population is, the less costs for healthcare and hospital admissions and those types of things. So it's at the individual level, but also at the social and societal level that we need to think about health. And we also have to define health in the appropriate ways, and recognizing that there's more than one way to look at what is health, what is balance. And in Lakota, one example I've used over the years is that I was taught many, many years ago that even in the dying process, people can be balanced and healthy. And it's a natural process of moving to the spirit world, taking our journey. And in modern medicine, we're constantly fighting that, right? We're looking at that ending or outcome as the enemy that needs to be fought. And in truth, we're fighting against nature. The mortality rate for humans is 100%, whether we want to admit it or not, right? But what's more important than the longevity is quality of life and wellness and wholeness and balance. And we're not very good at that in modern medicine. So we really need to think about that in terms of what's really important and what are we trying to achieve. So another consideration is that governments have a responsibility for health of their people, which can be fulfilled only by the provision of adequate health and social measures. And we have to think about this in a holistic way. And we should understand that educational quality is a determinant of health. Quality of housing is a determinant of health. But even at the societal level, reducing things like discrimination and marginalization is actually a health intervention. So we should be thinking of all of these things as they are connected to the health of our people. In Lakota, we say mitakue oyasi, meaning we are all related or all things are connected. And we recognize that in a public health perspective, that all of these other determinants or factors in society have a direct impact on health and well-being of the people living in that society. So in Lakota, we use the symbol, a medicine wheel or sacred hoop. And we recognize that in order to be healthy, we have to be in balance in all four directions. So we have spiritual health to the east, mental health to the north, physical health to the west, and emotional health to the south. And what I learned from a very early age is that when we're thinking about traditional medicine from a Lakota or many other indigenous perspectives, that health is not just physical health, right? But in modern medicine, what is another word for doctor? What's that? Physician, very good. So physician, so look at the word. We're saying right up front that we deal in the physical arena, right? Physician and physical have the same Latin root, physic, meaning the natural sciences. So we're very good at being scientists, but we're not as good at focusing on things like spiritual health. And again, I'll speak just from my own experience, and perhaps others have had different experiences in their training regarding the integration of spirituality into health. And nursing does a much better job of integrating spirituality. I've seen nursing curricula that actually talk about spirituality and health. That was not a part of my medical training. Actually, the only time the word spirituality came up was when I was doing my hospice rotation. So we had to wait till there was an impending death before we'd even say the word spirituality. Is that appropriate? And think about that. If spirituality is a part of life, shouldn't spirituality be a part of the health system? If we're looking at health and balance, particularly from our perspectives as Indigenous peoples and others who have more holistic perspective. Over the years, I've also had people ask me, well, what's the difference between mental and emotional? Because we do confuse those things in modern English language. You know, like we'll say something like, I feel that we should do this. Well, actually, that's what you're thinking, right? But we can kind of confuse thinking and feeling. And when we think about the arena of mental health, we have different arenas like thought disorders and mental health and schizophrenia, but we also have affective disorders in the emotional arena, things like depression. And those are treated very differently. You know, there's different types of interventions. And we've understood that really for millennia, that there is a difference between mental health and emotional health. It's the difference between what we're thinking and what we're feeling. And that has to be incorporated into the healthcare system. And when I look at the basis for a lot of our disparities and challenges, much of that is rooted in unresolved trauma. We have a lot of historical trauma. We have a lot of adverse childhood experiences. We've had histories of boarding schools and residential schools, marginalization, discrimination, racism. All of those things result in emotional and spiritual trauma. And then think about our children who go through things like abuse or neglect, right? Then that results even in a spiritual trauma, the belief systems and the value systems and the sense of self-worth. So when I think about that, and I think about my training as a physician, is there a pill that's going to fix spiritual trauma? No. The solution is not in the prescription pad. And I think that's one of our biggest challenges in modern medicine is that we have one tool, essentially, you know, in modern medicine. And it's kind of trying to make a square peg fit into a round hole. And I love the old saying, if your only tool is a hammer, every problem becomes a nail, right? And that's what I observe, what we're doing in modern medicine. And I don't know why. Perhaps there's just not enough diversity of thought and diversity of culture in the people who are actually developing medical curricula, right? And if you heard the discussion earlier, that's one of the big areas of focus now, is we need an indigenous school of medicine, and not just a bricks and mortar school, but a way of thought, a school of thought. That we are holistic, and there's nothing wrong with that. If anything, the emerging research and evidence is pointing to the fact that this is a better approach to achieving healthier outcomes. So what are factors that determine health? And clinical care is important, but it's actually less important than socioeconomic factors and the physical environment in which people live. So when we think about some of those other factors, if people are very impoverished, and we're even trying to do something like manage diabetes, healthy food choices are actually more expensive than unhealthy food choices, right? And what a travesty when you have a patient or a community member who wants to have healthier options but just simply can't afford it. And we live in a society in which your income dictates whether or not you have access to clinical care, but it also dictates whether or not you have access to a healthier lifestyle. And what a travesty. It really should not be that way, but that's how it's evolved. So when we think about these things, we have to recognize, again, one size does not fit all, and we're not going to have one approach or just health education. It's got to be a societal, broader impact if we're going to actually make those changes that we need. Where I'm from in Kyle, South Dakota, and I was amazed, there's like 5 people here that have actually been to Kyle, South Dakota, which is amazing. It's such a small little community on the Pine Ridge Reservation. But there we do not have a supermarket or a grocery store. We have a gas station with a convenience store. So think of the food that's there. It's things that's in plastic bags and cans. There's a small section for, we'll say, fresh fruits and vegetables. But because they're perishable, they don't last very long. And actually, in public health, there's this idea of a poverty tax. And a poverty tax is that people who live in poverty actually spend more money for healthier choices than those who live in more affluent areas. If you have easy access to healthy food, it's cheaper than if you live in a place like Kyle, South Dakota. So it's not truly a tax per se where the government's taking a percentage, but the people have to spend more money for healthier choices. And what a travesty if we have families that actually want to move in a healthier direction. There are barriers to doing that. So you can see how socioeconomics really is the factor that's driving much of our health disparities. So there are things that we can do about that, and we'll talk about that here in a bit. Also, genetic characteristics are less significant than the social and economic characteristics. In one of my previous roles, I worked for the National Institutes of Health and did diabetes research for NIDDK, and that's the National Institute of Diabetes and Digestive and Kidney Disorders, and that's the institute that focuses on diabetes research. And when I was working with them, they were convinced that the root cause of diabetes disparities was genetic. And some of the things that they didn't really keep in mind is that prior to 1900, there were actually a couple of comprehensive health surveys conducted, one in 1902, one previous to that. And across southwestern American Indian tribal groups, they found one case of diabetes, just one. By 1970, the tribe that they were studying had the highest rate of type 2 diabetes in the world. That community has 50% of the population over age 30 has type 2 diabetes. Isn't that amazing? Half the people over 30 have type 2 diabetes. So was there a huge genetic shift between 1900 and 1970? No. I mean, it is just so, I hate to use the word ignorant, but that's what it is. Why are we trying to find a gene when we know that there are other factors very directly that are causing this disparity? And in the area where I worked with the Gila River and Salt River tribal communities, you can trace it all back to damming the rivers. So the rivers were dammed in central Arizona to preserve water for the growing Phoenix area. So Phoenix is a desert, right? But there's still swimming pools and golf courses because the rivers were dammed. So the prosperity of that entire region is based on damming the rivers. They needed that water. And we can think of this as the prosperity of Phoenix was built on the backs of the health of the local tribes, because their food source and their water source was taken away. So their food source historically was very healthy. They had farming, and they had a really complex canal system and agricultural system. They had different types of corn, beans, and squash. There's actually hundreds of varieties of corn. Now when we think of corn, we think of yellow sweet corn because it tastes sweeter, and that's what people have evolved to like in this country. But there are types of corns like particular yellow corn, red corns and purple corns that actually lower blood sugar because there's more fiber than starch in some of these corns. They taste very good too. But we don't have access to that anymore, but they did have access to that. And then the different types of squash. It's a little known fact, but the original name of Phoenix, Arizona was actually Pumpkinville, Arizona, because pumpkin is a squash, and they grew acres and acres of pumpkin. So the original settlers that came out there, they named the area Pumpkinville. I'm glad they changed the name, because I don't know if you're a basketball fan, the Pumpkinville Suns just don't sound very good. But so then the name did change, but they were just thriving. They also had wild game because there's a water supply. So there were mule deer, pronghorn sheep that lived in the desert. When the dam went into place, they all moved upstream. They also had fish in the river. They had migratory birds that they would snare. Then all kinds of healthy, whole foods. And as soon as that dam went up, diabetes rates started to skyrocket, because then they were dependent on government commodity foods and food rations. So things like government cheese, and then these unhealthy foods that are engineered in a laboratory. So things like vegetable shortening, that is not a natural or healthy food. It's saturated with hydrogen, so it can stay as a solid at room temperature, and it helps to preserve it for a longer period of time at room temperature. But it's not healthy and it's not natural. It's actually a trans fat that actually easily binds to arteries. So the higher the trans fat ingestion, the higher risk for heart disease. So guess what? We have very high rates of heart disease in our populations, and a lot of it can be traced to the changes in food. So this bullet point, genetic characteristics are also less significant. What I find so disappointing, if we look at where we invest research dollars, we're trying to find the gene. Well, there's no gene responsible for that dam, right? That's not where we need to look. So the factors determining health really are about also the physical environment. And whether people are healthy or not really is determined by their circumstances and environment, the social, economic, environmental conditions which affect the health of the population. And historically, we had very healthy whole foods up in the northern plains. And we really relied on the bison. And the bison meat is much more lean and has a better nutritional profile than what we typically find in beef now. And historically, we didn't have any processed foods, right? So we had a lot of healthier food choices, and we've seen the loss of food sovereignty over the years. And those are social factors. Those are not genetic factors. So there's been a lot of work trying to define what are the social determinants of health. So these are the conditions into which people are born, grow, live, work, and age. And these circumstances are shaped by the distribution of money, power, and resources. So if we look at wealthier communities, they live longer. And that's not a value judgment, it's just the data. You can actually correlate life expectancy with income in the United States. Isn't that amazing? So if you look at the bottom fourth of income has the shortest life expectancy, the top fourth of income has the longest life expectancy, and it's like a dose response. The more income you have, the longer you live, which means poverty kills people. And we have policies in place that keep people impoverished. Isn't that horrible? But it's what we do as a society. And I have more faith in our younger generation. It'll be up to you guys to fix this, because our generations have failed miserably. So hopefully we'll see improvements as we move forward. But I am encouraged by the numbers of our young people who are becoming educated and moving in these directions and becoming activists. And I'm hopeful for the future, and hopeful for my future grandchildren as well. So social determinants are mostly responsible for health inequities. So it's the unfair and avoidable differences in health status that we see between populations and communities. And again, one of the simple ones is looking at income, but also educational attainment correlates with health outcomes. Higher quality education, you have better health outcomes than if you have lower quality education in a population. Now, it doesn't mean that people can't break out of the communities and do really well. We see examples of that. But the trend is that the worse the education, the worse the health outcomes. So these are really multi-layered issues, and they are societal level issues, community level issues, and individual level issues. So it's a very complex arena. And I won't go into too many details, and I'm sure many of you have already studied things like social determinants of health. But we have to think of this as a multi-layered issue, like a big onion that's being peeled, right? So there's general socioeconomic, cultural, and environmental conditions. There's societal level discrimination. Do we see that today? It hasn't gone away, right? We're not in a post-racial society. And then agriculture and food production, I've given a few examples of that, but of course, education, work environment, unemployment, water and sanitation. We have some of our communities that still, a fourth of the families don't have running water in some of our reservation communities. So they're dependent on other types of water sources that aren't always clean or healthy. That was a huge issue during COVID for some of the tribes. because for hand washing, you have limited water supply, but also with inadequate housing, how do you adequately do quarantine and isolation if you're already dealing with overcrowded housing conditions? So those are not genetic issues, those are social determinants of health issues, and we can see the very direct impact on health outcomes as a result. So we wanted to kind of build beyond the traditional social determinants of health when we're looking at our populations and look at indigenous determinants of health. So as I had mentioned, we created this alliance with indigenous health academics around the world, and it's just a wonderful group to work with and connect with. So we do have a website, you could just Google it if you wanted to, Indigenous Determinants of Health Alliance, if you're interested. And again, we've chosen the word indigenous very purposefully because indigena is a Latin term for sprung from the earth, or our original inhabitants. And it's interesting because I have these discussions with some of my colleagues, and some people don't like the term indigenous, some people don't like the term native, some people don't like the terms American Indian, et cetera. What's really interesting about that whole discussion is that as indigenous peoples, we're trying to find the right English word to describe us, right? It's like, well, that English word is better than that English word, and we have our own languages for ourselves, but not everyone here is Lakota, right? So we have to look at the next best option. So that's the terminology that we use through the United Nations. So the Alliance is an indigenous peoples organization devoted to advocating for and fostering culturally safe systemic change globally, and through the adoption of what is called the UN Permanent Forum on Indigenous Issues. There's a Indigenous Determinants of Health framework that we developed, and we've now had 4 publications come out of this work. So there's now even a toolkit and an evaluation process for communities to look at how we're engaging around indigenous determinants of health. So in our original document back in 2023, we made recommendations in 3 areas, and I'll kind of go over the individual recommendations, but the 3 broad areas. One is the need for intergenerational holistic healing. And for many of our cultures, the idea of intergenerational is part of who we are as a people and part of our cultures and our traditions. And the idea of a nuclear family is not our way of thinking. It's something that was brought over from Europe, the idea of a nuclear family. And who likes that term, nuclear family? Isn't that odd that we say that? And then we even define primary relatives or secondary relatives. That's not the way we think of it, right? What I was taught is that I have just as much responsibility for my nieces and nephews as I do for my daughters and sons. And one generation is responsible for the next generation. And what a powerful way for children to grow up and to really understand that they are supported by a whole host of adults who are relatives, right? One of my pet peeves in education generally, but I've seen it a lot in medical education, is that for many of our students who grow up in a traditional way, and they're very close to aunties and uncles, right? And we can even have, in Lakota, we call it a hunka, or making a family, that we have people who might not be direct blood relatives, but they're a family member in our way of being. So if they need to go home for a funeral, I've seen schools, medical schools and others, say, well, you can have an excused absence if it's a first-degree relative, right? Think about the arrogance of that. As a school, I will define for you who your family is what we are saying. That's horrible. It's arrogant, and it's wrong. So again, Indigenous School of Medicine, let's fix that, I've seen other examples where students were actually asked to bring in an obituary to prove that there was a death. And not all of the tribal cultures actually do obituaries. Some cultures, you're not even supposed to talk about it, right? So again, it's the colonizer's lens defining for us even what family is. So we can actually improve these things through an indigenous lens if we have intergenerational and holistic healing. The second area is the health of Mother Earth, and recognizing that the health of the earth has an impact on the health of its inhabitants. So there's this whole movement called planetary health, and you may have heard this. There's actually a planetary health alliance. It had been based at Harvard University for a number of years, and a couple years ago it moved to Johns Hopkins, so it's actually in the same building where I'm located when I'm in Baltimore. And in planetary health, their main premise is that the health of the planet has an impact on the health of people, right? From an indigenous perspective, that's kind of like saying 1 + 1 = 2, and they think it's brilliant and new science, right? But it's our way of being. We've understood these things forever, and in many ways, modern science is finally catching up to indigenous knowledge. But in my own experience, we did not learn really anything about environmental health, the issues with climate change and its impact on health in my medical training, right? That's not even a part of it. But there are now recommendations that have been coming out through AAMC and AMA and other organizations saying that we need to have the impact of climate change on health incorporated into medical training. So at least it's moving in that direction. But it really is a basic tenet of what we would do through an indigenous lens. And then the third area is decolonizing and re-indigenizing culture as a social determinant of health, but in this way as a positive determinant. So we don't always have to focus on deficits and weaknesses. We can actually focus on strengths as well when we're thinking about determinants of health. So think about intergenerational holistic healing. One of the research projects I'm working on right now is called Together Overcoming Diabetes. And the Together Overcoming Diabetes project is an intergenerational approach to diabetes management. It was originally developed in the southwest of the United States with Navajo and Apache tribes, and it's an adult with type 2 diabetes and a youth family member. And they define youth up to age 25, so just a younger person in the family. And it's a holistic curriculum that has the typical diet and exercise recommendations, but it's also tailored to what you actually have access to in a community, and ideas of eat this instead of that, not just assuming that everyone has access to kale and pistachios, because we don't, right? So there's the diet and exercise recommendations, but in addition to that, there's also a whole lesson on goal setting. Setting goals and following through is actually a skill that we can learn. And when we look at something like diabetes, there's so much self-management involved. You know, every day, our decisions that we make every day have an impact on our blood sugar control. But we don't teach people how to set goals and how to look at different tasks and actually getting from point A to point B. So that's part of the curriculum. And then another big part of the curriculum is stress management and developing skills to deal with stressors. People who are living in poverty are living under a great deal of stress, and we need to have skills to manage that. So this was done in the Southwest. It was culturally modified to tribes in Minnesota. And in both sites, they found statistically significant reductions in blood sugar, blood pressure, weight, depression, and anxiety. And everyone as a significant outcome for the participants. So we just culturally adapted it to Lakota and finished our data collection just August 31st, so just a few days ago. But it was just kind of a proof of concept. So it was a small number. There were only 40 dyads, so 40 adults and 40 kids. Half received the intervention, half had standard of care for diabetes management. And within just a 3-month period, statistically significant reductions in blood pressure, anxiety, and depression with that short intervention. And that's our way of doing things, right? Is that let's work with our families to build more social support. And that really is an indigenous determinant of health because it's what we're taught to do. And in modern medicine, understandably, we focus on privacy issues, right? Privacy rights and HIPAA compliance, right? So when I think about our traditional ceremonies, and if there's a healing ceremony for someone, the entire family and community comes together to support that individual. And you know, the power that you feel when you know that your whole community wants you to be better is just indescribable healing power. And I do acknowledge it might not be HIPAA compliant when we have a healing ceremony, but it's powerful medicine, and it's effective medicine. So as we're focused more on privacy issues, we're losing that ability to engage the family and community in the healing process. So we have a multitude of recommendations within each of those 3 categories. I'll just go over a few of them. Again, this is all available online if you're interested in seeing the documents. So one is to ensure intergenerational trauma training for Western mental health professionals and public health workers. Mental, medical, and public health. Training must be designed, and curated, and implemented or co-led by local Indigenous practitioners. So when I think about my medical training, and again, this is a long time, this is back in the early 90s, we didn't hear anything about the idea of trauma-informed care. That hadn't come up at all. But I'll tell you one thing that I did in my training, and for the physicians in the room, I memorized the Krebs cycle 4 times. So undergraduate biochemistry, the MCAT, medical school biochemistry, and step 1 of boards. Never used it once, right? So I had to memorize the Krebs cycle, but I did not learn trauma-informed care, which would make me a better clinician, right? Trauma-informed care. And that's not a part of our standard medical curriculum. I mean, it's improving now. We're seeing it incorporated in some schools. But we still have students memorizing, a series of enzymes, and whether it's Krebs cycle or glycolysis or gluconeogenesis or whatever it happens to be. And I just remember trying to memorize words, right? So just memorizing words so you can pass your exams. Is that a valuable use of our time? Especially now when I could ask Siri, hey, what's the 3rd enzyme in glycolysis, right? Why do I need to memorize that and regurgitate it for an exam? Especially if it's never used clinically. I've yet to meet one physician who said, yes, they use the Krebs cycle in their clinical practice, right? So we need to think about this. We need to actually be intelligent enough and humble enough to ask ourselves those difficult questions. Why are we teaching these things? Why are we requiring these things? And why are we ignoring things like intergenerational trauma, particularly for populations that are working with traumatized peoples, right? That needs to be a part of the educational practice, and that's one of the recommendations. We also need to incorporate local Indigenous physical, mental, and spiritual indicators in health assessments, particularly in primary care. And a little bit later, I'll show there's been a multitude of much more holistic health assessment instruments that have been developed and validated. It's really exciting. And we're incorporating a lot of those into our research projects. So again, these need to be developed in collaboration with local Indigenous populations, because again, one size does not fit all, but the idea of recognizing that there are holistic indicators of health is very important. And there's actually emerging very good ways to measure things like language preservation, language utilization in a population. So even if it's a different language, there's ways that we can measure language preservation in populations. So another is to develop in partnership with Indigenous leaders a national plan for each nation to implement cultural safety in healthcare systems and rooting out colonization, indoctrination into services, and to eliminate social stigma. So for many of our peoples, and I've had so many experiences in this arena where we have, I think, well-intended people, but they are creating circumstances that are not safe from a cultural perspective. So we've been doing things like sweat lodge. We call it inipi in Lakota. And we've been doing that particular ceremony for thousands of years. And it's a beautiful ceremony in which we use heated rocks that have been within a fire. They're put inside a sweat lodge, which is a dome-shaped lodge. And we pour water on it, and it creates steam. And we think of 4 energies: fire, air, earth, and water. And we use all those energies in this ceremony. Fire to heat the rocks, which is earth energy. So fire energy, earth energy, water energy, creating steam, which is air energy. So we're absorbing all those energies. And we had, at Phoenix Indian Medical Center, we had a sweat lodge, actually 2 of them on the campus. And one of the new physicians who had never been in the ceremony before said, we need to put a stop to that because of the risk of carbon monoxide poisoning. It's like, we're not burning the fire inside the sweat lodge. We're not idiots, but making people feel culturally unsafe, or looking down upon the practices. And with absolutely no lived experience to be making those value judgments or those recommendations, right? So again, it's an arena where we need more of our own people in these roles of leadership. We need to ensure that all services and media are available in local Indigenous languages. Some places are doing that very well. I love to see that here. I love listening to the Native Hawaiian languages. All the Pacific Island languages are just beautiful. disseminate research demonstrating that cultural practices and Indigenous languages are protective. And I'll show one of the studies that came out of Canada in which the communities with stronger language preservation actually had lower rates of diabetes. You know, but it's a good measure for cultural connectedness and wellness. We also need to ensure through legislation, policy, and regulations that sacred Indigenous cultural practices are legally allowed and protected. And that's absolutely necessary in the United States. Some of you might be familiar, there was a law in 1883 called the Code of Indian Offenses. Some of you can Google it. I like how Google is a verb, right? So we can find it. But the Code of Indian Offenses actually said the work of medicine men is against the law. They even called out specifically the Sundance was illegal, was against the law. And think about the hypocrisy built into that one of the founding tenets of this nation allegedly is freedom of religion, right? But if we're honest, it's freedom of religion for Americans except for the Indigenous Americans, right? It was actually made illegal. That's why in 1978, nearly 100 years later, we had to have an Indian Religious Freedom Act. You may have heard of that, the American Indian Religious Freedom Act, to counteract what was written into the Code of Indian Offenses. So we need to legally protect the practices, and I do get concerned about some of the pushback on things like diversity in our current setting. So we need to be strong in our policy recommendations. We need to design and develop a curriculum on the role of Indigenous spirituality in health promotion. And this would be for Western medical and mental health professionals as well as public health professionals. And the role of Indigenous spirituality is incredibly powerful. And I've seen again in my own family, those who are participating in ceremony and culturally connected tend to have better health outcomes than those who are more disconnected from culture. And the role of spirituality for anyone is very important in living in a holistic and meaningful way. That's where we find a sense of meaning and a sense of connection to ancestry and a sense of self-esteem. It's so powerful as a determinant of health, and in a very powerful way and in a positive way when we can promote this. We should also incorporate decolonized curricula, and we have to recognize that so much of our curriculum is done through a colonized lens. I had mentioned earlier, there's so many medicines that are indigenous, including aspirin, right? But we don't teach it that way, do we? You know, we teach it as though this was discovered by German scientists in the 1800s. No, we've been using this for thousands of years, right? Through willow bark and other types of herbal medicines that are now made in laboratories and said to be modern medicines. So we need to recognize that, honor that, and basically give the credit where it's due, that these are indigenous medicines, you know? We've always been scientists. It's just that the other cultures have co-opted our knowledge and claimed it as their own. So we need to decolonize the curriculum. So those are some of the recommendations, and there's even more. So if you want to look at the document, it's a pretty long document. But the second area was the health of Mother Earth. And I'd mentioned it before, when we say Mother Earth, we're not just being poetic or mystical, you know, that each of us is comprised of the earth, right? We're outcroppings of earth. All of our carbon, all of our minerals, all of our water comes from the earth, quite literally and quite scientifically. So we're each outcroppings of earth. And there's really interesting research, because we also have electromagnetic energy about us, right? And there's this whole idea of grounding, that there's actually a positive health effect when our skin touches the earth. You know, how often are we grounded, and how often are we on cement floors with rubber-soled shoes? You know, but then how often are we actually connecting with the earth, and how meaningful that is? And there's some really compelling research looking at the health benefits of that. So we have to recognize that the health of the earth is vitally important to the health of the inhabitants of the earth. So one of the issues, ensure that indigenous food system sources, including access to locally harvested traditional foods, exists. And we don't always have access to our traditional foods, unfortunately. So in South Dakota, for example, there was a time where the bison were almost completely eliminated. that was a main source of protein, source of food. And I'd mentioned the damming of the rivers and how that has completely changed the local food systems and local food sovereignty. So we need to ensure that those food system sources are accessible in our populations. We also need to ensure the protection of lands, waters, and foods for people locally and globally. And when I think about some of this, it also relates to the preservation of sacred sites. We did a project a little over a year ago looking at what has happened to sacred sites around the lower 48 states. And some of our sacred sites are now owned by private sector interests. Isn't that interesting? Isn't that terrible? Some of our sacred sites are owned by the state. So we have a creation story out of what's called Wind Cave, and that's actually a park in South Dakota now, owned by the government, not owned by us. There's also been desecration of sacred sites and destruction of sacred sites. And when we think about this, this is directly linked to our spirituality and our cultural practices. So we need to look at this in a more comprehensive way and have protection of those lands, waters, and foods. We need to design and properly fund initiatives for local Indigenous peoples and communities to find viable and sustainable alternatives as they try to recover their local food access and traditional foods. And that's been a big challenge. Again, we don't have the same access to traditional food as we used to. And there was, for many years, a food ration program that was very unhealthy food. And then what's now the commodity food program, or the FDPIR. There's a food distribution program on Indian reservations. And in fairness, they've improved it a lot in recent years. It's much better than it used to be. But historically, it consisted of very unhealthy food. They used to distribute corn syrup, pure corn syrup. And I have pictures of this. On the label, it says, use in baby formula. So this is from our USDA, not just recommending the engineered sweet corn syrup, but actually adding it to your baby formula, right? And that's a whole other USDA program, the WIC program, Women, Infants, and Children. And in over the last couple decades, there's been a much better effort at promoting breastfeeding. It's the healthiest thing for babies. But when I was in clinical practice in the late 90s, early 2000s, where I was working, the WIC program was basically a baby formula distribution center, just handing out baby formula. And you think about the culture of poverty, if you're handing out something that's expensive for free to an impoverished young family, they're going to use it. So one of the outcomes is that we saw higher rates of formula feeding in these populations as compared to other populations. And it's just a fact within the data. We know that formula-fed babies grow up to have higher rates of type 2 diabetes than breastfed babies. So now historically, again, our community processes were so much more healthy because not every woman is successful with breastfeeding. Some women have challenges with that. So historically, we would have wet nurses. Some people's job is to be the feeder of babies, What a wonderful thing. And there should be zero stigma attached to that, right? It's a natural process from our Creator. But people have still difficulty even, breastfeeding in public. Oh, what a shame, what a crime, what a travesty, whatever it is. But it's just silly. These are our processes that are from our Creator. And we had safeguards, safety nets, and communal and communitarian approaches to promoting access to healthy foods. So in the meantime, between now and getting back to more traditional foods, we have to have healthier alternatives that we can find. So we also need to develop an initiative for Indigenous leaders to provide education at the national and international level on Indigenous approaches to protecting the world's biodiversity. Particularly in South America, it's very devastating what's happened to many of the rainforests. They've just been burned up. And in many ways, we look at that whole area of the Amazon rainforest kind of as the lungs of the earth, because it produces so much of our oxygen, and burning all of that carbon is not good for the earth. Plus, how many of those plants that haven't been assessed yet could be medicinal? We could see cures within it. And we need to be able to protect that biodiversity. So again, support sustainable and restorative traditional practices for food systems and ensure culturally safe services that foster a balanced lifestyle for both urban and non-urban Indigenous peoples. So develop national programs led by Indigenous leaders, again, to reconnect to knowledge-based systems. And we did see some good movement under the Biden administration. You may have seen it, but the USDA did say that we need to expand our understanding of Indigenous knowledge around food. They use corn as one of the examples, and that we also need to look at the impact of policy recommendations or policy changes on Indigenous peoples. So it's really remarkable how so much of the policy for our people is dependent on the current administration and who's in charge at that time. But these really should be international recommendations. And we need Indigenous peoples with equity-based platforms so we can advocate for things like water quality, water safety. And again, that's a big issue in many parts of the world, even some of the reservations in the US. So I'll go through a couple of these a little bit more quickly, just to leave time at the end for discussion. But again, these are available online if you'd like to read them in more detail. So the third area is decolonizing and re-indigenizing culture as a social determinant of health. So decolonizing and re-indigenizing culture. So one recommendation is to work with Indigenous peoples and communities to design and implement a national plan to, one, foster elements that reinforce Indigenous communities, two, ensure proper incorporation of the Indigenous communities in the national identity. And we do see a whole variety of how Indigenous populations are treated worldwide. And in the US, of course, we do have a lot of challenges and negativity, but some nations are much worse, to be honest, the way they treat their Indigenous peoples. So really, again, this is through the United Nations Permanent Forum on Indigenous Issues. So they're trying to look at this from an international lens and recognize that there needs to be some degree of recognition and respect for Indigenous peoples. Also need to consider that language is key to cultural understanding and identity. And it's such a challenge because for many of our languages, we don't have exact translations into English, right? And even where we put a noun and a verb or noun and a adjective can be variable depending on the language that we're looking at. But it's key to really understanding who we are and our identity, and so many of our words are linked to ceremonial practices and traditional songs. So the culture cannot be unlinked from the language. So we should be thinking of language preservation as a public health intervention, right? Also develop in partnership with Indigenous peoples and communities a national assessment of the areas that need the most attention in terms of Indigenous rights. And we do have some of those challenges, certainly within the US. Do we have access to our sacred sites? Do we have access to our traditional foods? But other Indigenous rights, even participation in ceremony. I had mentioned it was illegal to participate in ceremony based on the Code of Indian Offenses in the US. Some nations still have laws that make it illegal for Indigenous peoples to practice their traditional cultures. So there's a lot of work that needs to be done at the international level to address these challenges. So another recommendation is to advance cultural models and practices as part of the overall healthcare delivery and educational system for Indigenous peoples. So one of the wonderful research projects that we're working on, I mentioned it earlier, is the ceremony-assisted treatment. And it's really compelling, and it's working very effectively for a lot of our people. But it's also something that's not reimbursable under Medicaid, right, or other health insurance. So it's really unfortunate we have to think in these terms, but for programs to be sustainable in the current system, there does have to be some sort of revenue generated for the treatments and the interventions. So, we'll pay for pills, things like buprenorphine for opioid addiction, but we won't pay for ceremonies, even though the ceremonies in many cases are more effective. So we do need to advance those cultural models and practices and recognize that if something is working effectively, we need to be able to invest in it. Another thing that we're working on now is expanding the role of community health workers. And I know that there's community health worker students who are here, which is wonderful to see, yes. So through Johns Hopkins, we have several programs that use community health worker models. One of them is called Family Spirit, and it's a wonderful home visiting program initially for high-risk pregnancies. It turns out everyone benefits from it, but it's from pregnancy to age 5 of the child, those first 5 years. So it includes things like a healthy pregnancy, healthy delivery, but then also meeting milestones for the baby and the young child, but also school preparedness, and then also health of the mom. You know, nationally, the issue related to maternal mortality is getting worse, and that's just a travesty. So maternal mortality is when there's a death of the mom, either during pregnancy or up to 1 year after giving birth. So while the baby's still an infant. In South Dakota, 10 years ago, the disparity for American Indian maternal mortality was about double the white population. Over the last 10 years, it's now 6 times greater. And you know what's just a travesty about this is that a couple of the drivers of this are overdose and suicide. We have young moms killing themselves. This is just horrible. And think about the intergenerational impact on the entire family, on that baby and the rest of the family. So we need to be able to use things like family spirit. And historically, a lot of our cultures would have kind of social worker type roles or community health worker type roles. In Lakota, we called it a shirt wearer society. And they were basically the ones who were responsible for looking after people in the community who were vulnerable. So in South Dakota, fortunately, community health workers are reimbursable under Medicaid. So our plan is to utilize Family Spirit, but we also have another program that uses a community health worker model called Celebrating Life. And it's been very effective at promoting wellness and preventing suicide. It's really good programs that use those community health worker models. So we're going to bring those together to try to address that. But again, it needs to be something that is sustainable, because typically these programs operate on grants, which is wonderful while the grant is being funded, but when the grant goes away, the services go away. So we need to think about this where we can integrate the cultural models into our modern systems, but make them sustainable, especially if we can show good evidence that they're working effectively. So we also need to carry out a national study on how the past and current systems are contributing to replicating and extending practices that lead to the destruction of local cultures. And unfortunately, we see that in a lot of cases, and there's, I think, just an overt lack of respect of diversity going on in some sectors of modern society. But that's not unique to just the United States. This is an international issue that needs to be addressed. And also implement a national campaign to create national awareness and educate all sectors of society on the important contributions of Indigenous peoples. So that's one of the things I've been doing a lot of, is particularly in the health sector and the STEM sectors, is that look at all these wonderful accomplishments we've had in science, technology, engineering, math, medicine, arts, all of these things. But quite often, the broader society is just not aware of those things. And it's up to us to increase awareness of those things. So also ensure that Indigenous cultural systems definitions of health are expressed by the local peoples. And you know, what do we determine to be health? What is health? Is health lack of diabetes and lack of high blood pressure, or is health more of a holistic, spiritual, mental, physical, and emotional balance? And that's got to be part of what we measure and what we strive to achieve in our populations. So our concluding remarks, the recommendations listed in the document, and these weren't not all of them, I just kind of did a highlight of them, but the recommendations should be discussed and explored with local Indigenous leaders to ensure cultural and contextual appropriateness. So they were broad-based recommendations, but it needs to be applied to local context. And many of these recommendations are interlinked and may be appropriate to solve multiple circumstances given the multi-generational and multifaceted nature of Indigenous health. So again, these documents are available online if you're interested. I can get those to you. And had a whole team of people working from all over the world on this particular project. So I've been doing more work recently with Sami populations in Northern Europe in both Norway and Finland. And on the left, that's a Lakota family. On the right, that's a Sami family from right around the same time frame. Isn't that fascinating? And if you look at the art, it's very similar. If you look at their drums, it's very similar. There's a lot of connectedness across indigenous cultures that we don't fully understand, but I think that needs to be a part of our solutions is let's work together. The one advantage we have now is that we have, this term hasn't really caught on yet, but ESIP, English-speaking indigenous peoples. English-speaking indigenous peoples. You know why that's important? We can now communicate, right? We can collaborate. We can join forces because we can understand each other. If I was just speaking Lakota, it wouldn't work, would it? But now, as we can have these international collaborations, I see that as a potential source of strength as we move forward. So how do we measure culture and wellness? So if you're interested, there was a series of articles called the Culture is Prevention Project. So this one was, it's published in the American Indian,
Formerly children.
the Siri was listening to me apparently. I know I should ask her, what's the third enzyme in glycolysis? So in the American Indian Alaska Native Mental Health Research Journal, there was an article on adapting the cultural connectedness scale for multi-tribal communities. So there's actually now a validated scale to measure cultural connectedness. And not surprisingly, the communities with stronger cultural connectedness have better markers of health. So that's an indigenous determinant of health that shows strength and power. And the outcomes are really compelling and very good, to the degree that if cultural connectedness was in the form of a pill, it would be standard practice. But since it's culture, it's not really integrated into medical models. Here's another one, measuring culture as a social determinant of mental health for Native and Indigenous peoples. And they've, again, found participating in cultural practices was good for mental health, not just physical health, right? So lower rates of diabetes and high blood pressure, but also lower rates of depression and anxiety. Also, cultural continuity as a hedge against suicide in Canada's First Nations. This is by Chandler and Lalonde. And this is just really now what I would consider just a seminal article on the importance of cultural continuity. And what they found is that the more cultural strengths and self-determination within the local community, the lower the suicide rates. And the less cultural continuity, the less self-determination, the worse the suicide rates. So you can see it's even at almost a quasi-societal level that we need to have these strengths. And these are really good emerging scientific basis for this work. So cultural continuity, traditional indigenous language, and diabetes in Alberta First Nations. And in this study, they were able to measure language preservation and language utilization in the community. And the communities that had stronger connection to language had lower rates of type 2 diabetes. Isn't that remarkable? It's also not surprising when you think about it, because really that cultural connectedness, thinking about language preservation, that is a proxy for that cultural strength and cultural connectedness, cultural continuity. So there's a lot of really good studies that are looking at this. So one of the things I've been using a lot of lately is called the Wichozani instrument. And Wichozani in Lakota and Dakota means wellness. So there's now a new Wichozani instrument. It's not that new anymore. I guess this was published in 2019. But we're using it in our research projects. I'd mentioned the research project for ceremony-assisted treatment and Together Overcoming Diabetes. We're using this instrument. And again, this is something you can Google and find it as well if you're interested, but the Wichozani instrument. So with this particular instrument, it's a survey instrument that combines Likert scale, so quantitative data, and then open-ended answers for qualitative data. So it's a mixed methods instrument that we can use. So how does someone know if their mind is healthy? How do you rate your mental health? So the first question is open-ended, more qualitative. The second question is numerical. Then how does someone know if their body is healthy? And how do you rate your physical health? So looking at thinking about what does it mean to have mental health? What does it mean to have physical health? And how do you rate your own health? So how does someone know if their spirit is healthy? And how do you rate your spiritual health? So it's basically a medicine wheel, looking at spiritual, mental, physical, and emotional health. So how important is mental health to your quality of life? And again, a Likert scale from very unimportant to very important. How important is your physical health to your quality of life? And how important is your spiritual health to your quality of life? So fairly straightforward and simple tool that has been validated. So it's actually been scientifically validated to be a good way to measure this type of holistic health. And as I had mentioned, we think of things in spiritual, mental, physical, and emotional realms. And now we have a tool that can actually measure those outcomes. And it's wonderful if you do this pre and post that we chose on the instrument. You can actually see changes in spiritual, mental, physical, and emotional well-being. And it's scientifically sound. I just love this, that we're bringing together concepts of indigeneity and indigenous knowledge with modern scientific methodologies. And we could do this repeatedly. I'm sure there are systems in Hawaii, but other Pacific islands that could do similar types of work. And I know there are people developing these tools. It's very exciting to see that all move forward. I do want to leave some time at the end for questions and comments. I know we're done at 3:15. But think about other approaches to measuring health and well-being, other ideas or other experiences, and what is your cultural lens through which to see this and to do this work. So I think what I'll do is end it there and say thank you all very much for your time and attention. So we do have 8 or 10 minutes if there's any questions or comments. Or was anything on the chat by chance? No? Okay. Nobody wants to be first. Huh? So questions, comments?
Have you seen COVID have any effect on cultural things?
Yeah, very good question. What was the effect of COVID from a cultural perspective? Well, one very sad outcome is we lost a lot of elders. A lot of our knowledge keepers died during COVID. So one of the other projects I'm working on now is developing a traditional indigenous medicine textbook, because we're developing, of course, this DRPH in Indigenous health and the Indigenous School of Medicine. And we want to incorporate traditional medicine, but we should ask the traditional healers first what they think we should share, because not all traditional knowledge should be shared, but some of it can be. So this first project is to interview traditional healers to get their perspectives on what we can and cannot share, from their perspective. But unfortunately, we did lose a lot of knowledge keepers during COVID. The other thing that happened is we wound up having 2 years of ceremonies canceled. We didn't have Sundance and Sweat Lodge because of COVID. So there was an interruption. So it did have a negative impact, unfortunately. Yeah. Any other questions or comments? Yes. Yeah, luckily through the Permanent Forum on Indigenous Issues, we do have some staff members that are looking at that. So I'm not doing it personally, but we do have people with those international connections who can look at that. And the sad part is in many parts of the world, there's really not much progress. And there's overt discrimination against Indigenous peoples in many parts of the world. And it's really unfortunate. But we're trying to track that through the UN as well, yeah. But I'd love to connect with what you're doing here. Yes.
I'd like to comment that I like to think in terms of a social medicine approach. As Paul Farmer said, this would be a historically deep and geographically wide look at things. I think from the perspective of history, it's obvious that Hawaii is a settler colonial entity, and at least there wasn't a genocide here, whereas the continental U.S., also a settler
Yeah, and that's a huge challenge because there are still those who don't really fully respect the idea of intergenerational trauma or historical trauma. But many of us observe it, you know, that the trauma is handed from one generation to the next, sometimes in very direct ways, sometimes in indirect ways. But we do have to recognize that this is a challenge and a problem for many of our populations. But also remembering, again, we can't change the past, you know, but we can influence the future. And what I observe is that when we incorporate ceremony, culture, language into the healing process, and it's a recovery process for many of us in terms of trauma, that we have better outcomes when we do that. The challenge is making those practices available at scale to really make a big impact. So that's where we need the big social change and the recognition of indigeneity as health protective components of who we are, and to work with each other and really utilize those skills and strengths that we each share. But it's not an easy process. You know, it's not going to happen in this generation. It's going to be in future generations. So what we need to do is create the framework and the foundation from which future generations can be healthy. We need to think 7 generations ahead. And wouldn't it be wonderful in 5, 6, 7 generations that we don't even have to have this discussion anymore? That would be powerful. Yeah. Yes.
I'm not sure if you can answer this, but one of the things that I worry about with Indigenous health and wellness is the fate of our brothers and sisters in the Pacific who will be losing their lands to, for example, sea level rise. Their societies will become climate refugees, having to move somewhere else. That disconnect from land and all that means for Indigenous peoples. I'm wondering what that conversation's looking like on the global level, like at the UN, because it really means that other communities will have to support them, but yet you've lost that. I don't know. I was just wondering if there was any thinking, at least on the global scale, of how Indigenous communities can support those that will have lost. The ones that are impacted the most are the ones that, of course, contribute to the problem the least.
Yeah. Yeah, it's a huge challenge, and we're looking at potential devastation of some parts of the earth because of sea level rise and other impacts of climate change. And I don't know how to get people to care about it more. You know, it's a real challenge because there are those who don't see it as a problem, or they call it a hoax, and you hear all these crazy things that are just anti-science, anti-fact, because it's not convenient. But I think part of the challenge, just quite honestly, is that, you know, what many of us are taught is that we're supposed to think about future generations. We're supposed to care about others. We're supposed to put the community first. But what I see in our modern society is a lot of very selfish people that put themselves first above everything else. And that's a deeper rooted sociological challenge that I don't know how to solve that. I just wish that they were more thoughtful human beings, but they're not. It's a big challenge. Yeah. We have 1 more minute. Any questions, comments? Yes.
Thank you for your time and knowledge. I just had a question on integrating those cultural practices into the health system. For the ones that you've been working with, what are some strategies you guys have been able to find to create return on investment?
Yeah.
So that, because we are an incentivized society, work on incentives, mainly right now it's money.
Yeah.
So what are some strategies that you guys have seen attempting to implement these to create that return on investment for governments or businesses to buy in?
So a couple strategies. Well, actually, more for the communities, not necessarily for the businesses, but for the communities. Through the Indian health programs in the mainland, you know, we do have the opportunity for tribes to take over the management of their healthcare programs. There's what's called the Indian Self-Determination and Education Assistance Act. So tribes can actually take over the management of their programs and incorporate traditional healing if they choose to. I've seen many good examples of that. So more local governance is very important. And then in terms of other programs where we are seeing some movement is with community health workers. Thank God, right? That what we can show and what the policymakers care about is not only are we having better health outcomes, we're actually saving money. If we're preventing emergency room visits and hospitalizations, that actually saves a lot of money. So we have to be able to learn to think in those terms and to present it in those terms as well, in order to integrate it more effectively. Yeah. But I know that gets me right up to the end of my time, so just want to thank you all very much. Appreciate it.